The conversation this morning is on understanding the differences between STIs and STDs. We have our guest here this morning. Now, our conversation is going to be very serious because a lot of people do not like to talk about STIs and STDs because of the connotation, the stigmatization and all of that behind it. But so before we even talk about the differences, we need to break them down. What exactly is the difference between STIs and STDs?
Well, STIs are the infections, sexually transmitted infections, and sexually transmitted diseases. So the difference between the two is that an infection, an STI, is actually a surface infection. It occurs when a bacteria or a virus or a fungi enters into the body, into the skin, but hasn't caused an unrepairable damage. It becomes a sexually transmitted disease when the infection, the virus or the bacteria, has officially broken down the immune system of the individual. Then it becomes an STD. So the difference is between the surface and curable and between the deeply broken down immune system and the uncurable.
Can you give an example of an STI that becomes an STD?
An STI that becomes an STD could be genital herpes, HIV, from HIV to AIDS. From genital herpes, you have HPV, that's the human papillomavirus. So those are two samples.
Okay,
yeah. We have others too. We have trichomoniasis, we have pubic lice, we have syphilis, we have gonorrhea, and so many others.
Do all sexually transmitted infections turn into diseases or vice versa?
Well, not all sexually transmitted infections actually turn into sexually transmitted diseases. It all depends on how soon you take care of it. Let's take the instance like gonorrhea, when a woman has gonorrhea, if she's able to detect it maybe within 2-3 weeks, and she treats it, it doesn't develop into pelvic inflammatory disease, and it doesn't lead to things like ectopic pregnancy and all other complications, so cervical cancer and rectal cancer, So not all infections actually turn to diseases.
So you're telling me that sexually transmitted diseases or infections can actually be a leading cause to ectopic pregnancy?
Yes, very much so. Ectopic pregnancies, arthritis, eye inflammation, that's the inflammation of the eye. We also have miscarriages, also responsible for some miscarriages. We also have cervical cancer, we have rectal cancer, especially for those that practice anal sex, so many other things. And we also have other mouth infections as well, for those that practice oral sex too.
Interesting.
Yeah.
Interesting.
So how often should one get tested?
Well, the question is in two phases. One, medical doctors, we medical practitioners, we usually advise that every individual should get tested every 6 months.
Okay.
Every 6 months. But for those that have multiple partners, we're in today's world, the computer age, for those that have multiple partners, so if you know that you've been with a partner and it's been unprotected, or you have been exposed to maybe body fluids and maybe unclean toilets, those are places where we can easily pick STIs and STDs, then we do need to get tested as soon as possible.
Yeah. So earlier, before you came in, Omobolade and I were talking about the price. It seems like, and please, because this, I want you to answer from your experience and dealings with people, So from what we understand, there's a Nigerian culture on placing the priority of contraceptives and protection on not getting pregnant rather than getting infected. Is that true? And if that, culture is prevalent in Nigeria, why do you think so?
Well, the culture is prevalent because, number one, I think the World Health Organization has been trying severely to control the population of the world in terms of talking about being enlarged and going overboard of our resources. So that's the reason why it's more prevalent than actually preventing the infections and the diseases. But the World Health Organization has also been able to, by statistics, that over 1 million people do get infected every year, and that for every year we'll have about 367 new infections coming up. So that is quite enormous.
Wow.
About 367 million new infections coming up, yearly, with over 1 million people dying out of sexually transmitted infections and diseases. So now I think we're waking up to the essence of actually not just protecting ourselves from unwanted pregnancies, but also taking care to make sure that we don't get infected with infections and diseases.
Talking about getting infected, I want to know, apart from actually, getting it via sexual, through sex or intercourse, is there any other way? Because I know that people talk about urinary tract infections and all. Is that part of the mix too?
Yeah, it is part of the mix too. Well, getting infected has to do with other things too. Like we could also, actually, like I said, I think I mentioned you just a few minutes ago, we can pick up STIs and STDs from toilets. We can pick it up from body fluids. So that means if we have someone that is actually infected already or has the disease for like some time, it may not necessarily show on the face. And then maybe in the process of touching, that's why we even advise, even before you go into sexual intercourse, you take a bath, we should take a bath, We can get, through the hands, through the body fluids, through kissing, of course, and then through the rectum, that's the anus. So for those that practice anal sex, through the mouth, for those that have that practice oral sex. So if a person has a wound or an injury in the mouth, maybe a bleeding or a dental decay, then definitely they're going to get it.
Wait, so you said something about dental decay right now.
Yeah.
Dental decay is not an STI, but if the person has an STD,
yes.
And if so, a person kissing them can get the
STD. Definitely. Okay. Because one of the symptoms too is infection. You first find out that the person begins to have a very terrible mouth odor, then the mouth becomes, there's the rashes all over. And of course, it's not just like the normal rash, the mouth becomes actually swollen. So when the medical doctor sees it, you just know, oh, there's a syphilis or this, other kinds of sexually transmitted.
Interesting.
So you can tell someone's STD from their odor, from their mouth odor.
Oh, of course, definitely.
Very interesting.
There'll be so much rashes all over, and not just the mouth, other parts of the body, but definitely you know that this is coming from,
Whoa, okay. I would like us to actually mention some STIs and STDs. Let's categorize them. So we were just mentioning some diseases that we felt we knew, like gonorrhea, like you've mentioned already. You've said syphilis. We even said chlamydia. You talked about genital herpes. So what are the other ones? What are infections, like the list of infections that are very popular and the list of diseases?
Okay, we have about eight popular infections and diseases together.
All right.
4 actually have more are synonymous with infections, and that's the gonorrhea. We have the trichomoniasis. We have syphilis, and then we have the genital warps. Okay, then for those that are commonly classified according to the STDs and are usually uncurable, in quotes, we have the HIV. We have AIDS, we have HPV, that's the human papillovirus, and we have genital herpes as well. And then we have cytomegalovirus virus. That's very similar to the HIV virus, What actually happens is that it just builds up T cells, and those T cells actually go in, you understand, like they tend to multiply themselves, so to say, thereby breaking the actual, body system, so to say, and then I think that's basically it. So those 4 are classified as curable and infections. But of course, those infections can also become diseases if not attended to.
If not attended to.
But in the case of HIV, you just keep managing it, you keep taking your drugs and, antibiotics, drugs, and maybe creams and all that.
So curable infections can become incurable diseases if not paid attention to.
Exactly. Yeah.
So how, so for instance, somebody has genital herpes. How long does it take to become a disease? And what disease does it mutate into?
For instance, from, let's say, anything from like 3 months to 6 months, but medical doctors will give you like 6 months.
All right.
So some even take it into their body for so long without even knowing until it becomes very severe. Like, for instance, take a woman that is trying to conceive, and maybe it's just... she keeps taking the regular malaria paracetamol, she visits the local herbs and all that, without actually knowing that there's actually an underlying cause that is causing it. So in the case of genital herpes, before you know what's happening, it turns to hepatitis, it turns to HPV, and then it becomes incurable.
Interesting.
You just have to manage it, over time.
Right.
So now there is a vaccine.
Okay.
There is a vaccine, for HPV and hepatitis.
Hepatitis,
Okay.
yes.
Okay.
So-
All right.
Yeah, so this is so interesting
Yes.
to me because I made a lot of things that we're trying to uncover this morning. Now, let's talk about STIs and STDs to how it relates to reproductive health. Now, you've already talked about how STDs can become can lead to ectopic pregnancies and other diseases. Now, for a female reproductive system, what other things can STD do to apart from ectopic pregnancy? How does it affect the reproductive system?
Well, some of the effects reproductively could be things like you have the pelvic pain. Over time the woman would find it difficult. As a matter of fact, it's even one of the first symptoms. She finds it very difficult to walk. Because of the pain. There's a very heavy should I say like a body? It's sometimes it feels like a cramp, sometimes it feels like a body, And apart from that, again, the woman over time she may have cervical cancer. She may have she's exposed to things like rectal cancer. I think I did mention that.
Yeah.
And in the long run, she may also become sterile. It also goes for the men too, as well. Low sperm count, infertile spermatozoites. So that's just about it, yeah.
Does it affect? So now, how do you know that you already have STIs or STDs? I mean, you said something about some people not knowing at all, and then you've talked about symptoms, that is the pain that you feel and all of that. But as a male or a female, how do you know that you've been infected?
Well, not all infections and diseases come with symptoms.
Correct.
Yeah. So one could even have it for as long as donkey years without actually knowing that, yes, you do have it. And one could, if you're living healthy and maybe you're already on some prescriptions, one could even just go ahead and so when the doctor makes the test and you have this, you're like, no, it's not possible. It's not possible, but actually it is possible. So some come with symptoms and some do not. Everything actually comes with symptoms, but some do not, see the symptoms or they do not feel the symptoms. So for those that do not have the symptoms, they need to get tested. Like we said, yes, every 6 months it's always good to go for the test. And when it does come with symptoms, we have things, but especially for the male, we have things like rashes, we have burning, we have pus from the penis, we have irritations around the skin area, and not just the skin area. Sometimes it's like little dots and patches. It comes with a lot of discoloration, especially for the male. For the female, it's actually a foul smell from the vagina. Then you have a lot of discharge as well. You have pains. You have the heaviness of the bust and all the infections. Sometimes hot flashes. That's like a fever or internal heat. So the system, you just know that the system doesn't feel right. And of course, when it's especially for the women, because the woman's reproductive system is actually internal. So most women do not actually have the symptoms as early as a man. A man's reproductive system is external. Yeah, so a man, like in the case of having a sexual intercourse, like now, a man could actually, by tomorrow, in the next 24 hours, he could start feeling uncomfortable, itching, pause, painful urination, blood in the urine, So obviously, when I go to urinate, I don't feel this pain, there's no blood and all that. So he's able to detect. But for a woman, she could go as much as 6 months before she begins to have, those symptoms, coming out.
Interesting.
Well, okay, so it is so interesting because some people would have this for about 6 months and more and have no idea that they're actually going through some of this because some symptoms are not as visible as the other one. Now, you said something about it being contagious. Yeah, let's talk about that. So you were talking about bodily fluids and kissing and also what other way can people contact
like
us?
for like when a partner is infected and the other is not infected, obviously when they come together sexually, whether oral sex, whether vaginal sex, whether anal sex, the virus, the bacteria is able to travel from one person to the other person. So through the blood, through the saliva, through the body fluids, so even through the clothing, you know. So those are some of the ways that, you know, it's easily contactable and spread and from one person to the other. Yeah.
Well, so now this is even more dangerous because if
you're kissing somebody that, if we're kissing somebody that has maybe like the syphilis, for instance, or maybe the gonorrhea, so the saliva gets mixed up, you know.
Oof. So you just have to be careful out there.
Yes, exactly. And then if the person has maybe an ulcer or a cut in the mouth, or maybe while brushing that morning, you know, there's a maybe a little bruise, you know, so then definitely the other partner is going to get it.
Wow.
See why you shouldn't share toothbrushes with your partner?
Thank you very much.
Okay.
Yes.
In fact, it's so
very insightful.
It's very insightful.
Actually.
Yeah. But before we let you go, let's talk about treatments. So how important is it for people to go get tested and also get treatments, and what sort of treatments can be used?
Well, it's very important for people to get treated as soon as possible. As a matter of fact, one of the ways that, there's so many ways, you know, that we can prevent the STIs, like using condoms. We also have what we call genital gams, you know, so it reduces the effect of actually getting infected through kissing and oral sex. Then we have other ways as well of, you know, getting prevented, getting tested, talking to your partner about it. Now, it's very important for people to get tested, but we find out that most of the time people are in denial, people are ignorant about it, people are scared about it, people obviously are thinking about the reactions of family members, and so because of that, they tend to like stay backwards. In the treatment of STIs, there are various treatments. For the bacterial infections, we usually go for just normal antibiotics, you know, not normal really, like ceftriaxone, we have azithromycin, we have diazoxycline. Then for the viral cases for STIs and STDs, it will need more antiretroviral drugs for their treatment, and of course, there are antiretroviral creams and lotions too, as well for the treatment. So that's just about the summary of it.
It's so interesting that you decided to break this down for us this morning. And of course, we opened the phone lines because we wanted guests to viewers to call in to ask some of their questions and all of that. So we already have Dolapo on the line. Dolapo from Elukweju. Good morning. Thank you for joining us.
Hello, good morning.
Hello, good morning, Dolapo.
Good morning, Bolade. Good morning, Adi.
Good morning.
I'd like to ask our guest a question. I'd like to know if STI and STDs, if it is possible for someone to have them without knowing that he or she has them, and do they go away on their own?
Did you get the question?
If it's possible to have them without knowing.
And if they go away on their own. Thank you very much, Dolapo.
Well, Dolapo, yes, it is possible for us to have STIs and STDs without actually knowing it. Like, remember when the jingle started for HIV, it was like, you know, they show for face. You know, that was it, you know, they show for face. So, yes, we can have it without actually knowing that we have it. As a matter of fact, most people are actually moving around with it without even knowing that they have it. And no, it doesn't go away on its own. It does not go away. No little infection of STI goes away on its own. It needs to be treated.
Wow. All right. Okay. In fact, if you have STIs or STDs, as our guest has said this morning, try as much as possible to get tested and get treated. Thank you so much, Dr. Amadu Fatima Zinta, for joining us
Thank you so much for having me
this morning.
It's a pleasure.